Hi, I'm Dr. Sakul. I'm a non-invasive cardiologist with Intermountain Health. I like being outside in general, being part of nature. I like cooking. I like watching soccer, being out with friends, talking to people, reading books. One of my uncles was a cardiologist, and I saw how he did things and, how the family looked up to him for anything guidance related. So that's kind of how it started for me, and straight out of high school, went to med school. Cardiology, I would say, is the most advanced, and I say this with some bias. And that is part of the reason a lot of people get attracted towards cardiology, whether it's the devices or the interventions or even the monitoring. And nowadays, as you see, AI is everywhere, and we have, not surprisingly, incorporated AI into our EKGs or monitoring people with heart failure. If you're able to diagnose a disease before it actually becomes a disease, which is, for example, the EKGs where you can detect something 10 years before it becomes clinically obvious, that's very helpful to the patient, the family. And post-acute care, for example, heart failure, we have technology where you can check your volume status, how much fluid you have. You can check it on your phone. So that keeps people out of hospitals, close to their loved ones, and that's what we like. Some of the hardest things you will hear in your life, something that you will remember for the rest of your life, whether it's about a loved one or yourself, you tend to hear it from a healthcare provider, a doctor. So it's important to understand that we have your best interest at heart. The most important message is we are part of the team. We're on your side, and we'll work with you. And I also think that once you keep the heart healthy, you've in a way kept the whole body healthy.